our Doctor's Day, and we have an email from Nicole, a mom with asthma who is now watching her toddler struggle with the same symptoms. She writes to us, "Dear Dr. Stork, like so many people, I can't be without my inhaler because my asthma is so bad. For me, that's just how life is. But now that I'm watching my daughter go through the same thing, I'm desperate for help. I've been looking for a holistic way to treat our asthma, and I heard salt caves are maybe a miracle cure. What are the benefits of trying something like this?" Well, since Nicole wanted to try a new holistic cure, we decided to give her the salt cave therapy that she craved.
We are in a place where it's almost 16 tons of salt, including walls, including the floor. There's so much iodine in it, and as you know, iodine you're using for cleaning the wounds and helping killing bacteria. The air is very dry and very easy to breathe, and that's how it actually helps for your asthma. Nicole and her daughter are good candidates.
I was diagnosed with exercise-induced asthma when I was 13 years old, and I found out my daughter Jasmine had asthma when she was 2 years old. It just completely broke my heart. She was hospitalized. Her allergies can just, I mean, in a heartbeat, it sets off like that. She has to have medicine every single day. Currently, Jasmine and I both use our albuterol inhalers. I have one in my purse, I keep one in my book bag, I keep one in the car, I keep one at home. There's always one around, but I would really love to be able to find some sort of natural way to get asthma more under control without the use of albuterol.
Hi, welcome to Gallus Caves. This is where the session begins. Walk around, grab the salt. The more you walk around, move it, the more you can inhale it.
A lot of people, when they come first here, they don't believe they will help anything. After 45 minutes, they say, "Oh my gosh, I have to come back and I have to bring my friends."
It's just really, really great. I can fall asleep in here all day. Wish it were longer than 45 minutes.
And the question we're all dying to know is, do you think it helped your asthma symptoms?
Oh my gosh, you know, initially it didn't even occur to me that any changes were taking place, and I'm like, oh, you know, I'll go and check it out and hopefully it'll work out for me. And then I realized that I went 2 weeks without giving my daughter a treatment with her nebulizer machine, which is not, her asthma's been so bad since we found out that she had it, especially during the summertime and as the seasons change. And to go 2 weeks without using her nebulizer was a really huge deal for us. And not only that, but normally when I go to spinning class, I normally go like 2 or 3 times a week, and I would use my inhaler before class, and then about halfway through I'd have to use it again. And this one day I realized I used it before just out of habit, but I made it the entire way through the class without having to use it. And I'm like, huh, that's interesting. And then it happened again the next day. I tried it, and I was like, well, you know, I'll just look and see if I can make it all the way through without using my inhaler at all, and I did. And I would assume that the only reason why that happened was as a result of the salt caves. Nothing else in our habits changed. We didn't try anything new besides that.
Asthma, as you know, it can be very dangerous indeed. I take care of a lot of kids in the ER who come in sometimes in extremis. Asthma, it's basically reactive airway disease, is the airways themselves can become inflamed to the point where it's difficult for air to flow through them like they normally do. And that wheezing sound that you hear, that's air trying to pass through those constricted airways.
Wow.
And what albuterol inhalers and other treatments do is they try to prevent that from happening or reverse its course, which is what makes alternative therapies like salt cave therapy so intriguing, because I'm scratching my head thinking, well, how could salt caves help with asthma and all these other ailments?
Right.
So we brought in Dr. Joseph Sciabbarrasi. He's here in our audience. He practices integrative medicine. Thanks for being here.
It's a pleasure. Yeah.
And I'm going to start this all off and say that I'm a very open-minded doctor. I believe in integrative medicine when it's been proven to work, and I also believe in trying modalities that if there's no harm in it, try it. Salt cave therapy, there's no harm in going into a salt cave. There's nothing bad that's going to happen. In theory, how do you think this could possibly help asthma?
Travis, this is really interesting. I mean, when you think of it, you're creating a microclimate in that chamber. You've got very small sodium chloride particles that are getting into the upper airway and into the lower airway. You've got a very low bacterial count. You've got a very low allergy count. It's a very comfortable, relaxing environment. The humidity, the temperature is great. And on top of that, you've got many different ions in that environment. Many of those are negative ions. So that's the setting in which it works. But the kicker to me is that there's an entire branch of medicine that has been developed in Russia called halotherapy, which is to replicate these environments in chambers. They are marketed as accepted certified medical devices in Russia. They have been doing research on this since, in my looking at the published research, going back at least 30 years. There's got to be a reason why this system has been in existence for at least 300 years that we know about.
You practice integrative medicine.
Correct.
And if you want to explain quickly what that means.
Integrative medicine is combining the best of conventional medicine with other techniques that might be Eastern in origin or might be complementary to the practice of conventional medicine. It's kind of an East and West combination.
When therapies are proven to work, whether it's Eastern or Western, you got to use both of them. My problem with things like salt caves is it's based upon anecdotal evidence, and there's absolutely no proof that they actually do work.
Well, I got to take issue with you on that, though, Travis. Look up halotherapy. Look up speleotherapy, which is cave therapy. You're going to get a printout of probably 40 different articles. They've been published in Russian. This is my whole point about this. Because they come from another country and we're not familiar with that literature, doesn't mean it's invalid. It means we should pay attention. We should look at this.
No, that's not true, but the types of studies that they do can sometimes be invalid, meaning that they're not the gold standard of type of study that you need to actually prove that something works.
Well, I'm glad you wrote that up, Lisa.
Study.
If you want to get real honest about this, we use medications every day as physicians, all of us, that are listed in the physician's desk reference. But if you look at how many of those medicines have actually gotten clinically valid, double placebo-controlled blinded studies that are valid studies, it's less than 50% of the medicines we use. We use these medicines, why? Because they work.
When can you consider an integrative medicine technique, a holistic technique, to be potentially valid? Because there's so much gimmickry out there, and you have to admit that. There's so much false hope and gimmickry that it's frustrating to me as a physician, because I want to give people real hope.
Yeah.
And how do they know when it's gimmickry versus valid?
First of all, I think you have to look at what the training is of the practitioner you seek to go to. Where did they get their training? Where is that from? A person generally seeks help from me when they've already been around the block with everybody else. They're on medicines, they're struggling, they're having side effects, and they're having a difficult time with everything they know. They want to feel safe coming to a doctor who they feel can help guide them through that process.
And I want to say thank you for sharing your opinions, and also for you braving the salt caves and enjoying the salt caves on top of that.
I did.
Up next, it's Ask Our Doctors, Kids Edition. I hope Dr. Shears has recovered from the incident earlier, because kids have questions that they need answered.
Hi, I'm Morgan. I'm 4 years old. If I sit too close to the TV when my eyes hurt.
The answer to that question when we come back.